Welcome, and thank you for joining us for the Resilient Communications for the Emergency Operations Center. This is presented by Jordan Arnswald and Darren Schnedler. Jordan Arnswald is an emergency management specialist for NNSA's Los Alamos field office. From 2017 to 2019, she went on an international assignment with the International Atomic Energy Agency, or IAEA, in Vienna, Austria, and worked in the member state preparedness unit updating the IAEA's manual for first responders to a radiological emergency. She is a doctoral candidate in public safety emergency management with Capella University and has been researching communication issues during radiological and nuclear emergencies. Darren Schnedler serves as the Continuity of Operations Program Manager for the Emergency Management Division at Los Alamos National Laboratory. Darren brings more than 23 years of combined experience in the field of emergency management and safeguard security operations to this team. His value experience includes several years of service with the U.S. Navy, as well as his career at LANL with the Protective Force, the Deployed Security Program, and previously the team leader for the Emergency Operations Support Center within the EMD division. Please remember that you can enter your questions for the Q&A time after this presentation on the chat there in Attendify. And now it is my great pleasure to introduce Jordan Arnswald and Darren Schnedler. The virtual stage is theirs.
Good afternoon. My name is Darren Schnedler. I'm the Los Alamos National Laboratory COOP Program Manager.
And my name is Jordan Arnswald. I am the COOP Program Manager for the NNSA Field Office in Los Alamos. Thank you for joining us today. We're going to get started with an overview of some of the operations that have been taking place, the EOC at Los Alamos National Laboratory. Darren will provide a background on some of that information, and then I will provide some context on some research I've been doing that ties together with what's happened at Los Alamos over the last year.
Great. We're going to start out with a little bit of the background of Los Alamos National Laboratory. As many of you may know, we're actually on 36 square miles of facility here. That includes a plutonium facility, multiple firing sites. We also have an accelerator that we use. And we also have multiple nuclear high hazard facilities. 22 of them, or 20-ish of them, are EPHAs. We have 12,000 triad employees with contractors and federal workforce on site. Los Alamos National Laboratory includes 4 entities at the site, which includes 2 federal field offices. And we have 10 mission essential functions for our COOP program. Our EOC is around 30,000 square feet. We have backup redundant networks, which we have proven that work very well during our pandemic operations. We have a 24/7 incident command response here. That's our Emergency Operations Support Center, and we have an incident response commanders that actually are here 24/7 and can actually move out into the field and do any type of emergency support if needed. We have a mobile command unit that can move right out of the EOC and get moving anywhere off-site or even on-site. It's all dependent on where the emergency is. And we do use a mass communication system called Everbridge, and we do have web EOC. We have about 140 ERO members here at the EOC. They are, a large portion of them are volunteer, and then many are a part of our emergency management division and our field office. So let's just kind of go through some of the pandemic onset things that happened. If you guys, everybody recalls, of course, in March of 2020. I know that in February we started getting some information that potentially COVID-19 was going to be a problem, but really in March is when we started getting a large amount of information that said we needed to start reacting to COVID coming into our regions. So many of us were a part of what we call the COVID task force here at Los Alamos National Laboratory. That included some of our senior leadership, multiple SMEs, emergency management, our medical director. We had our occupational medicine group leader there. Coop, myself, and Carolyn Zirkle were there. We had legal on hand, and we also had our occupational safety and health division leader that was participating with the task force. Right away, we developed some COVID on-site work activity policies to help us understand as a workforce how to bring those safety-related activities into our regular day work. We stood up an on-site COVID response procedure that helped us formalize how we were going to respond to any positive COVID cases that had made it on site or people that were symptomatic with symptoms. So we did that right away. We also established a COVID hotline so we could have a place for employees to call in at any time, 24/7, so we could respond very quickly to anything related to COVID. Our communication folks created a COVID hub, and this was a central location of where we needed to bring related information to COVID for our workforce, so they knew what they were going to be doing for any kind of policy updates, rules, and regulations that are related to the safety envelope. You know, travel, everybody was dealing with travel. Everybody was dealing with being, 6 feet apart. When do you need to be wearing masks? All of those things were identified on this COVID hub, to include who do you need to call. So that was something that we brought together quite quickly. Another thing that we were lucky to bring together was the testing program that was brought up in March of 2020, and that helped us identify the workforce, the portions of the workforce that were becoming contagious with COVID-19 and needed to actually respond to. We also started a vaccination clinic at the beginning of 2021, which was an excellent clinic, and we were able to actually go through and get many of our employees vaccinated, and we'll cover that later. We do have a pandemic advisory team that met regularly just to communicate all the different changes that were happening across the laboratory. And then in late March, just talking about communication, that went really well. We went from a workforce on site of 14,000 people to a workforce of 1,674 people instantaneously. So it was as instant as possible. The laboratory used communication tools extremely effectively, which just shows that we did have a good communication resilience strategy in place. And then the next piece is we did have really good communication between our field office and LANL. And as you can see, we're actually in an active EOC, so we do have some overheads going on.
And this was a really important piece, this communication between the field office and the laboratory, something that really made our team effort as resilient as possible. We were in constant communication with each other. We were all having to make decisions, and in situations where we were gathering as much information as we could, but we needed to be able to make decisions quickly. So this last bullet on the communication between the different entities was really key in establishing resilient communications.
We'll go to the next slide, but I did want to just show you on the right of your screen is a graph of what we've been doing throughout the duration for workforce accountability. We do one once a month, as you can see, and I don't know if you can see that 10,864 employees that were on site at the beginning of March, and how much drastically it declined in March, at the end of March, to 1,674 employees. So it just gives you kind of an idea of the evolution of on-site activity when it comes down to the workforce being on site and working. Okay, now we're going to just cover some of the EOC COVID operations. Like I said, we do have a 24/7, 365-day a year COVID response operations, and we did use that when we were responding to COVID. We brought up a COVID hotline, which was also a call center. So we used a system to create our call center. It took care of our on-site and off-site capability. So not only did we have some augmented operators that were working here on-site, but we also had them working off-site, so we could reduce the spread of COVID also to our own operations. So a hotline could be done anywhere, anywhere from the hotline operation workforce or the staff members could do it from home, and they could do it from on-site, which is extremely important. We have an incident response commander that is here 24/7. They are able to take any information from the hotline, which in fact, once a hotline operator receives that information, they do a line of inquiry and they get all the essential information related to the case. They put it into one of our systems, and then it goes to the incident response commander, who then starts dealing with the response functions that they need to do based off the severity of the case. And then if there is a need, we also had a COVID disinfecting and cleaning team that was done through some of our logistics and craft services. They were trained and qualified to deal with this type of infectious disease. And that worked extremely well once we got them up, and they were able to work 24/7, 365 days a year, along with our incident response commander and our COVID hotline call center. Again, we talked a little bit about the COVID communication hub. It was easy to access all the docs, the articles, all the policies. We even have a few videos of our biological safety officer who was showing the right way to wash your hands, put on your mask, make sure that you're not transferring and contaminating across the laboratory, and those kind of videos. Also included our director, with just talking about reinforcing some of our policies. And then the great thing is we were able to use this hub to actually share between all our 4 separate entities here at the lab, which included our field office, which Jordan is from, Triad, who is our Los Alamos, which we're considering Los Alamos National Laboratory when you hear that. And then also our Los Alamos Environmental Field Office, and another one that's our Newport News Nuclear BWXT Los Alamos, which is short N3B. So all 3 of those entities could go directly to the hub, and they had a common operating picture of exactly what we're requesting or enforcing when it came down to COVID-like policies. We also had a really good virtual capability that we used, which was an assortment of WebEx, Zoom, and Skype, mostly WebEx from our standpoint. And it was great. It was a great way for us to actually prove virtual capability of our EOC.
This turned out to be a really powerful tool because the field offices were also sent home to maximum telework, but we also have senior federal officials who need to be looped in very quickly to the EOC should something occur. And so this allowed for federal employees to be in communication with the EOC, to hop on a WebEx or conduct business via Skype, even though we had people, spread throughout different areas working from home. So this was a really, really great capability and allowed us to have constant communications.
Another capability we used was our mass communications. We do have a system called Everbridge, fairly powerful tool that we can use quickly. It actually worked with our workforce accountability efforts that we did once a month, which we usually do the second Thursday of the month. We also worked virtual drills through Everbridge, getting people to actually respond to how to get back onto WebEx and making sure that our ERO was still ready to function anytime they needed to. We also had a vaccination surveys that we were using. So we were trying to figure out how much of the population was interested in getting vaccinated, especially here on site. So we knew exactly how much vaccine we needed to order. And that tool is used to find out a kind of a good idea of the vaccinations, like I said, we needed to order, and who was going to be coming through our clinics once we were able to get the vaccines on site and through our occupational medicine. The other areas that we used is we do live in an area where we do get a little bit of snow here and there through the winter, which was when the vaccinations were administered. And there were some appointments that we needed to cancel because we closed the lab operations here on site. So we were able to go directly into the Everbridge notification system, pick those employees that were scheduled for vaccinations, and let them know that all of those clinics were not scheduled for the day and that they would have to be scheduled at another time. So that's another way that we use the Everbridge system. So here's just kind of a quick little Reader's Digest version of what we're doing now here at the EOC, well, from 2020, March of 2020 to present. So the laboratory is still operating at maximum telework. We're still doing that, and we want to make sure that we're being as effective as possible. So we do have a slight increase, as you saw on that one slide, of on-site personnel. On-site testing, like I said, started in March of 2020. And we've had approximately 24,000 tests that have been administered and analyzed. We used our biological division SMEs to actually bring up a capability where we could analyze each one of those tests, and within 1 to 2 days, we're able to get the results very quickly, which is extremely nice for knowing exactly who is testing positive for COVID and where they have been for contact tracing, and making sure that we're reporting everything appropriately from our management here at LANL up through our federal stakeholders and state stakeholders. Also, we've done a lot of on-site vaccinations that we began in on January 4th of 2021. We did go through a prioritization of vaccine strategy. As many of you recall, vaccines did not come out as fast as we would like. And so we had to prioritize who got them first. And of course, it came down to our emergency responders were first priorities. And then we really started focusing on our mission essential function and COOP staff, and then went directly to the high risk workforce, and then hit our general population directly after that. At this point, we're right around over 12,735 vaccines administered just here on site, and that has been primarily at our EOC vaccination clinics. So that's a very good news story. And another area that we really wanted to highlight here is a shout out to our Easy IT. They deployed a large portion of our IT equipment that was needed for us to do all our teleworking, and it worked really, really well. That included all our laptops, the webcams. We're having all these fun virtual meetings, which we're doing right now, iPhones and other IT solutions. And it's a one-stop shop. It's a central location where our employees and workforce can go and get those services taken care of very quickly.
All right, now we would like to share with you a quick video that shows kind of the whirlwind of activity that was taking place at the EOC, the height of COVID response with vaccines and testing going out. So we'll show you that video now.
Okay, so the next portion of this is we're actually going to go and Jordan's going to discuss some of her research that she has been doing through her studies and as a PhD candidate.
All right, thanks, Darren. So I am currently a PhD candidate at Capella University, and I have been conducting research over the past year or so, slowed down a little bit because of COVID-19, but I've been conducting research on communication issues during radiological and nuclear emergencies. The COVID-19 pandemic happened, unfortunately or fortunately, in the middle of my research. And it turned out there's a lot of similarities between the response and even planning for pandemics, similar to what you do in the case of radiological and nuclear emergencies. For my study, I conducted interviews with emergency management professionals from across the country. And the main requirement was that they work in or with a state that has at least one nuclear power plant. Because those states are required to have some pretty in-depth communication planning efforts. So, with radiological and nuclear emergencies, as well as pandemics, you have a situation where there's an unfamiliar hazard, there's an increased anxiety within the public, within workers, within responders, and you have, in the communication aspect, plain language becomes even more important because you're explaining a concept that the public is not familiar with or workers are not familiar with, but you're trying to get people as informed as quickly as you can. So with this, during the research, I think every single person I talked to mentioned their response to COVID-19 and some of the lessons that they've learned. Sometimes their struggles as well, but really how it's helped them become more resilient and feel more prepared should they need to respond to a radiological or nuclear emergency. So some of the things that participants mentioned were a really big one was having a shortened time required for their response officials to get to their EOCs. In some cases, in certain areas, they mentioned having commute times of 2 hours or more, whereas now, because they were forced to go virtual, they have all their stakeholders are able to quickly hop on to a virtual platform, including the media, including different groups from, could be across their state, depending on where they're located, but really, really able to get people online very, very quickly. The next thing my participants mentioned was the ability to ensure they had backup technological capabilities. So because they needed it during COVID, now they have tested this and they know it will work should they need it in a future emergency. This is, including things like making sure you have Wi-Fi hotspots available for all of your, responders, anyone that is physically present in the EOC so that they can get online. Another thing that participants mentioned, which was really, really key, was establishing call centers with professionally trained personnel to take, sometimes these can be very emotional phone calls. I had participants that mentioned, they experienced this during 9/11, Fukushima, and then now with COVID-19 as well, where it can get emotional, it can become traumatic. With COVID-19, people were scared. And so this is something that came out as a really key takeaway. And just for comparison, in Los Alamos at the lab, since the start of COVID-19, they've fielded more than 10,000 calls through their COVID hotline. In some weeks, over 1,000 calls easily, and that's just with employees. So it goes to show that having that workforce that knows how to take those phone calls really just enhances your capability to communicate with your workforce, with others who have questions, and then still be able to respond to other emergencies and other activities that are taking place at the same time. All right, another key takeaway that my participants mentioned was going to a virtual setting allowed for increased capabilities with establishing a common operating picture, where this has maybe been a challenge in the past, especially in areas where you have nuclear power plants and you have a lot of different stakeholders that might not interact on a regular basis. Now they're trying to communicate, and I heard instances where you have multiple different phone lines that people were using and ways to call in. Sometimes in certain areas, if you get kicked out of the phone line, it could be a challenge to get back in. But going to this virtual setting, whether it's WebEx or Teams, just really strengthens your capability to have a common operating picture, and different areas mentioned that they've made significant progress in this. A big overall, having this increased resiliency for EOCs, they have more flexibilities. Where it might have been a challenge in the beginning, my participants did mention some technological growing pains, but having to be forced to interact virtually really in the long term has increased their resiliency as well. I heard participants mention they feel like because they've responded to COVID now for over a year, some of them mentioned they've been doing press conferences on a weekly basis, very regular communications with whether it's with other response organizations or with the public, but they now feel like the daunting task, should there be a prolonged radiological or nuclear emergency where you have a release into the environment, and we know this is something that will take months, if not years, to recover from, and so they mentioned they feel more prepared should this occur because they've experienced a prolonged communications period with COVID-19. So with that being said, I think we've all experienced the last year or so, I guess 18 months now, and there have definitely been challenges throughout the pandemic, but what we've found is there have been some positive lessons learned as well. And so what we have here, we like to call the silver lining of COVID-19, and really the lessons learned. The first one we have here is we've been able to conduct some great benchmarking with other DOE sites. And we really want to say a thank you to Sandia, Livermore, and WIP, as well as many others. But from the onset of the pandemic, we were in daily communication a lot of the times with other sites and able to talk through ideas and what everyone was doing. And that was really, really key to making quick decisions. The second lesson learned we have is now that the COOP devolution can be done virtually. And this is something that allows for more flexibility and is just a different way to think about activation in the case of an emergency situation. The next lesson learned we have, again, that EOC operations can be conducted virtually, and this is another tool in the toolbox to ensure that members of the ERO can get online quickly and be participating in an emergency. We all know that in an emergency situation, you have to be communicating and you have to do it as quickly as possible. And this is just another way that can be done.
The next little portion that we learned was that Everbridge is an actual great tool for us to use. It gives immediate information and notifications out to the workforce, and it can be used in multiple different ways. It doesn't have to just be for emergency protective actions like we had used in the past, but can actually be used for multiple things like surveys, making sure that the employees know that new important information is out there for vaccines, especially when it came down to scheduling or testing, and our accountability. Those are some of the areas that we really, really focused on Everbridge being used to communicate to our workforce. Another area that we used to our advantage was that central location for COVID communication, which was called our COVID hub. This gave accessibility for communications with articles and policies and procedures and videos and information related to COVID to our workforce and the 4 entities that we had described previously. That was just a powerful area for employees to go and find one answer instead of it being in multiple areas, saved them time and frustration. And not only that, we also had a centralized call-in area through our COVID hotline. Not only did the COVID hotline take care of people that actually had positive results from a test or were showing signs of COVID, they were also calling the COVID hotline to make sure that they understand the rules and regulations that we were placing on the COVID hub. So it was another way for us to communicate to our workforce for that standard communication with one answer. So that was another great lesson that we had. With that, that concludes our communication resilient presentation. We really appreciate your time.
Thank you for your presentation, Jordan and Darren. We had the privilege of them presenting this last week at the COOPS breakout session. So I'm actually going to start the Q&A with a question that arose last week that we didn't have time to address. This question is, in your research, did you ask or find out what were the reasons people were refusing the vaccine?
Hi, Berna. This is Jordan. Thanks for that question. No, I actually did not find that in my research. My research was really geared towards understanding communication during radiological and nuclear issues in radiological and nuclear emergencies. So the parallels I was able to draw with the COVID-19 pandemic kind of came as just side comments I received in my discussions with my participants. I didn't actually ask any questions that were specific to COVID-19, but obviously all of the individuals that I interviewed are a part of the response to the pandemic, so they were able to share some of their experiences. It was definitely something that was mentioned as a challenge that my participants were seeing, as something where the public was given instructions, and even though they were given facts, it wasn't always as easy to implement the recommendations. And so drawing the parallel with things like evacuations and things you would see in a radiological or nuclear emergency, but I wasn't able to draw any conclusions as to why there are individuals who do not want the vaccine. Thank you.
Thank you. Darren, did you want to add anything to that?
Yeah, sure, Verna. From my understanding, and I don't have percentages, but we've had quite a few meetings with our medical director and some of our COVID task force, is some people are waiting on FDA approval. Some people are, some individuals just will not get the vaccine. And some individuals are waiting for the employer mandate. So those are some of the areas that, from my understanding, employees are waiting on, or indecisive, or just not willing. Thanks.
Thank you. One other question came in. Can you give us your top positive change which arose out of the pandemic in the way you do communications for the EOC? What positive changes come from that you'll never go back to the old way?
So the way that we used our mass communication system, we were only using it for updates and any type of high risk emergency where we needed to communicate across the site. We were able to actually get quick communication related to COVID policy, COVID vaccination schedules, COVID testing schedules, either making sure that people knew that they were scheduled for a test or vaccine, but also during delays because of snow or bad weather in the area, we were not able to get them into our testing or vaccine clinics. So we were able to get information out to those specific individuals fairly quickly. I see that coming up again as something that we can do for communications in general, and this is all related to pandemic response and also some of our mitigation strategies. And then the other one is just what we're doing today, which is WebEx and Zoom and all of those pieces. Just as an organization in EMD, we do use it quite often, and we're able to bring a lot more people into our conversations, which I think is a very positive thing. Thank you.
I couldn't agree more. Jordan, did you want to add anything to that?
Sure. Yeah, so I would say in my research, one of the most positive things that I saw was talking with the participants. I think that they will really be looking at how they engage with radiation experts in the future. So having radiation experts involved with exercises, talking with public information officers, really getting looped in when they're preparing for radiological and nuclear emergencies. I did hear that quite a bit from my study participants, that they saw the challenges with having experts on TV, on social media. And so I think, at least from the people I spoke with, it was kind of, everyone thought that, if a radiological nuclear emergency occurs on a large scale, you get the experts and they're going to kind of save the day and they're going to pass the information along. And so I think one of the positive things is realizing that, bringing them in sooner, getting them involved with your communicators, understanding how to word things in plain language. And so I really think for my study, that's something that is a positive thing looking forward, as these experts, radiation experts specifically, in my study's case, will really be more heavily involved in the planning phase, which is really going to help when communicating with the public in the future. Thank you.
Thank you, Jordan. Well, I'm not seeing any other questions roll up. I do think that Jordan and Darren have expressed that there are a few silver linings to all this, although I truly look forward to seeing everybody in person. I hope next year at this time. Thank you again for your presentation, Jordan and Darren. And I want to remind all those that are attending, please fill out the survey form so that your attendance will be recorded. Also, if you all would remember that this evening at 4 p.m. Mountain Time. Remember, it's all about us in Albuquerque, so it's always Mountain Time. We're having our social hour, and tonight it will be a formal dress or costumes, and that doesn't have to be you. It can be your children. It can be your animals. Anyway, thank you again, and I hope you'll join us for some more wonderful presentations.